Today we'll be doing a review of ultrasound basics here. We have the new Sight machine. First things first, you want to get some protective equipment on, definitely some gloves, and the next thing you want to do is you want to make sure you wipe the machine down with the sanding cloth. These are germicidal disposable cloths made specifically for the ultrasound machine with the red top. And then here we're going to start going into some of the learning. We'll start with the female pelvic ultrasound, and we'll move in through some of the more ICU acute care stuff and more into the OBGYN and the musculoskeletal with the anesthesiology at the end. Enjoy the review.
Transducer with a pelvis exam type is used to perform the pelvis ultrasound exam. A full bladder is used as an acoustic window to view the pelvic organs. The pelvis is evaluated in two planes. Place the transducer in a long axis position with the orientation marker to the patient's head at the level of the symphysis pubis. Angle the transducer inferiorly into the pelvis. The bladder appears in the near field of the image as a hypoechoic triangular structure. The uterus is gray in appearance and located either directly posterior or superior to the bladder. The endometrial stripe will appear as a bright echogenic line from the fundus to the cervix. The uterus does not always lay directly in the midline, so it may be necessary to slightly rotate the transducer to view the entire length of the uterus. Sweep the transducer from side to side to see the entire uterus. The ovaries may be seen by sweeping the transducer to the lateral aspects of the pelvis. They are almond-shaped and slightly hypoechoic structures. Follicles may appear as multiple hypoechoic cystic structures within the ovaries. Some follicles may be quite prominent, depending upon the luteal stage. To obtain a transverse view of the uterus, rotate the transducer 90 degrees so the orientation marker is to the patient's right. The bladder appears more rectangular in shape in this view. Sweep the transducer superiorly from the level of the cervix to the fundus to see the entire uterus. The ovaries will be seen on either side of the uterus and can vary in location from a superior to inferior position.